Hello, now today is another episode of this health video, and I'm going to talk about the testicular self-examination. When last did you check your testicles as a man? Now, do you need to check on them, or rather, do you need to examine your testicles? And how often do you check them? Now, today I'm going to talk about the steps that one needs to know during testicular self-examination and what you need to check on during this examination. Now, kindly watch this video to the end to learn more of this testicular self-examination. Now, if you're new, kindly uh, welcome and subscribe to this YouTube channel to get more of these health videos. Now, when I talk about the testicles, what I just mean is that the testicles are part of the male reproductive system. A man has two testicles, and they are just egg-shaped, which is 5 centimeters long, and they're just covered in a skin sac called the scrotum. So this is what we call the testicles. Usually the testicles make what we call the hormone, which is the testosterone hormone, which just is very crucial during male reproductive and maturation. It also makes what we call the sperms. Now, therefore, the examination, testicular self-examination, is just a screening, you know, a screening technique that involves, or rather, that includes the inspection. You have to look. And the other thing is it includes also what we call the palpations. You need to touch. This gonna make you to detect more conditions that can affect the testicles, such as the varicocele. We have the hematocytes, the testicular carcinoma, which is a very rare, but it can occur, and all other conditions, even the sexually conditions, sexual transmitted disease, and even some skin conditions. Now, therefore, one needs to understand that during testicular self-examination, as a man, you need to check for the swellings, the skin changes, and also you need to check if there is any pain. Do you feel pain, or is the swelling is just painless? Now, this will make you to just seek medical attention. Now, there are steps that one needs to know during testicular self-examination. Now, one, when you're taking a shower, assuming you have gone to take a shower, so you need to stand in front of a mirror. This one can expose your testicles and the manhood. So therefore, you'll be able to inspect, or rather, the look for the swellings, and also check for the end skin changes. So after you have just checked on those skin changes, or maybe hyperpigmentation of the scrotum or anything that is abnormal that you need to seek medical attention, you also need to do a gentle feeling. You need to feel the testicle, so you need to touch the scrotum, or rather the scrotal sac. Then you just feel the scrotum, which is an egg shape. Then you just gently, palpate one testicle at a time, So this gonna help you come up with maybe if there is pain, if there is what we call the swellings, is there any cyst that you feel during the touching. Once you are done with the right testicles, the right testicle, you go to the left testicle. Also, you do the same. You just roll the testicle in between your thumb and the index finger. You just check. You check each part of the testicle. so that you can be able to come up with an abnormality in the testicle. Now, the normal things that you gonna get is that during inspection is that one testicle is a little bit lower, than the other, and that's very normal. Is normal human anatomy. And then the other thing is that during these palpations, you may be able to just elicit one of the cord-like structure, what we call the epididymis, that is on the lateral and or from the top lateral side of the testicle. So that's very normal. Sometimes you can be able to say that what is this? A little bit cord-like structure. So it's very normal. So those are the only things that sometimes you can be worried of. Why is the testicles a little bit lower than the other? Why is this one a little bit, So that's very normal. And then the other thing that you need to elicit maybe a cord-like structure, that's the epididymis, that is stores what we call the sperms. So therefore, one needs to stand in front of a mirror, look or inspect for any swelling, skin changes on the scrotum. And then the other thing is that you need now to gently, feel the testicle. Once you have done so, that you have come up with a testicle, check it. Roll the testicle in between the thumb and the index finger to check for any swellings, any cysts, any pain that you feel during this what we call the touching. Now, all this examination, you need to do it monthly, so that you can be able to just know that there is no any condition that can affect these testicles, as the testicles are very crucial in the male reproductive system. Now, therefore, this is all about testicular self-examination, and what you need to come up with, and what you need to inspect, and how do you need to feel these testicles. So in case you come up with a lump, that's a swelling, maybe you come up with some skin changes, you come up with maybe you feel pain during gentle touching, you need to go to the hospital. You need to go to the hospital, and then you seek medical attention for maybe the doctor to do further examination and investigations and some imaging to come up with a clear or a diagnosis of this what we call a testicular abnormality. Now, thank you. This is the end of this video about testicular self-examination. Do it monthly, and make sure that you share this information to anyone you think can benefit from this health video. Now, thank you. See you in the next episode. Thank you.